How do you think, obviously the information when you started your career is different now, and at least and then the availability of it is different now. How has your philosophy changed on patient care over that time? Um, or has the philosophy changed at all?
I think that's one of the biggest parts of the menopause care, to be honest, is that, when I was going through training, we were not taught menopause care.
Mm.
I'm a urologist, traditionally urologists aren't who would manage menopause anyway, but in general, we were coming through training at a time where people were scared inappropriately by the Women's Health Initiative study that preemptively published information in the popular media, really, that scared people out of using hormones. And it really changed how doctors were trained. And while urologists didn't traditionally do this, even gynecologists or primary care doctors were pretty much taught not to use hormones. They were calling patients, and telling them, stop your hormones, throw them out, don't use them. And then, even as some of that data changed, there was such a bias about it that it really became more of a training in, well, if you don't have to, don't use it. But if you have to, do it this way or that way to minimize risk. And we didn't focus on helping the patient and what they needed and the risk we were causing by not managing this stuff. And I
Yeah.
think that thankfully we've reached a time where people are starting to be aware that it's not